Core training during pregnancy. Can you do it? Should you do it? And what even is the core? There's a lot of myths and confusion all over the internet about this, and I'm here to break it down for you. So first of all, when people think about the core, they tend to think about the front of the core, which is known as the abdominal muscles. And the abdominal muscles during pregnancy, there's a line down the middle known as the linea alba, and that actually has to separate to accommodate the space. But it creates an issue if we are not understanding how to allow that core to still remain strong, resilient, and functional, even when it's having to adapt to the load of pregnancy. The core system includes the abdominals in the front, the respiratory diaphragm, our breathing muscle in the top, our pelvic diaphragm or our pelvic floor at the bottom, and some back muscles and tissues in the back. So all of these parts are like gears on a machine working together to manage the pressure in the abdominal cavity. And you can see here, there's something in this balloon, there's something in this system, and it's a pregnancy. And it doesn't just stay small like this, it gets bigger and bigger and bigger. And now that pressure has less places to go. So maybe it goes forward on the abdominals and we see abdominal doming. Maybe it goes up, we get a umbilical hernia, a hiatal hernia, or it can move down on the pelvic floor. Now we're experiencing things like prolapse and incontinence. And so really what these issues are, they are core system issues. They are showing us what the body is communicating is that we need better core support. Yes, abdominals in the front, but also the respiratory diaphragm, the pelvic floor in the back. So we want to get all of these gears on the machine working together optimally. Do you think that if one gear of machine was polished up and shiny and working well, like spot training the abdominals or the pelvic floor, do you think that machine would work well together with one shiny gear? It wouldn't. And so what our job is during pregnancy is to get all of that stuff communicating well together so that too much pressure isn't pushed forward on the abdominals or pushed down on the pelvic floor, which can create an injury. So core training during pregnancy is not only recommended, it's actually essential to helping your body to remain strong and resilient to all the loads of pregnancy. So think about this core system. At the top we have the rib cage. In there we have the respiratory diaphragm. At the bottom we have the pelvic floor and the pelvis. And now these are having to work together to manage pressure. What's going to happen if we don't know how to do that well? We're going to have too much pressure forward on the abdominals or down on the pelvic floor, creating issues. And so what we want to do is we want to address those issues holistically by getting the core and the abdominals, if we want to talk about abdominal training, to support that system holistically. We start by learning how to engage our deep abdominals. So the abdominals actually have layers of tissues. We have the obliques and the rectus abdominis in the top, and then deeper down we have what's called the transverse abdominis. Our transverse abdominis is like our God-given girdle. It's designed to wrap in and cinch in when engaged. This is going to protect that system. But here's the deal, we don't want to over-engage and cause a gripping strategy. What's going to happen if we over-engage is we're going to push a lot of pressure down on the pelvic floor. So learning how to engage your deep core with a non-gripping strategy is the first step. From there, we want to learn how to engage that core well as we're doing activities and movements. So lifting up your toddler, lifting up a heavy laundry basket, lifting up a kettlebell or a dumbbell or something, we should be able to use our core and our abdominals to support us and to support that load. First, learn how to engage your deep core without a gripping strategy. Then we learn how to use our core as part of our activities of daily life and in our movement program. Pretty soon you're lifting your toddler, you're carrying your laundry, you're going through your life in a way that your core, your pelvic floor, and your whole system works really, really well.